If you're a chiropractor, an osteopath, a physio, or anyone that treats the spine, or maybe you're someone that suffers with low back pain or buttock pain, and you've not been able to find a treatment that's been effective for you, then this is going to be the video for you, because I'm going to go through a condition that I believe is one of the most underdiagnosed causes of low back pain and buttock pain. And I've only personally discovered this in the last year or so, but I've had tremendous results in fixing, and that's Maignes syndrome. Now, you may have heard of this potentially back at college or university when you studied, if you're a practitioner, but maybe you've forgotten it or not known how to treat it. So in this video, I'm going to show you firstly how you can very easily identify this problem, and then secondly how you can very easily and effectively and very quickly as well treat this problem. Let's begin. Hello, my name is Dr. Stephen Hulme. I'm a chiropractor based in Reading as well as the Oxfordshire area. And in this video, I'm going to be talking about Maignes syndrome. And I'm very excited to talk about this because I've had tremendous results in fixing this problem. And it's also a very common problem. I come across this multiple times per week. And yet I do believe it's very, very often missed. And I used to miss these also up until about a year ago. So let's start off with what is Maignes syndrome. And I'll just use my spinal model here to help show you what this condition is. So in the spine, just very briefly, we have three main sections. So we've got the neck or the cervical spine, and we've got 7 bones in there. We've got the thoracic spine, which is going to be the mid back here. We've got 12 bones in there. And then we also have then the lumbar spine, which is at the bottom, which is your low back. And we have 5 bones in there. Now there's a junction where the thoracic spine in the middle here joins the lumbar spine at the bottom. That we call the thoracolumbar junction, or the TL junction for short. Now there's a bunch of nerves that come out of this area, and these are the nerves that supply the sensation mainly to the skin of your low back, your buttock, your hip, and your groin. Now the main nerves that are affected in Maignes syndrome are going to be the superior cluneal nerves. These nerves come out between L1, L2, and L3, so the top 3 lumbar bones or the joints in the lumbar spine, and they're going to come down the side of the spine and go over the iliac crest here and then supply the buttock. If I turn on the nerves here, we can then see 3 nerves that go over this iliac crest here, and these are going to be the superior cluneal nerves. Now there are a couple of other nerves that can be also affected in this area, and that can also then give the groin pain or the hip pain, but the main ones and the most common ones are going to be the superior cluneal nerves. Now the main area that these nerves get impinged or irritated is going to be over this iliac crest. There is a bunch of fascia where this nerve travels through, and quite often this fascia will cause irritation onto the nerve, and that's going to be right over this iliac crest. So this is how we're going to help to diagnose the problem. This is what some of the tests are based on, and also when we start treating this problem, this is where we're going to be focusing right over this iliac crest here over the pelvis. Now this condition can mimic lots of other conditions, and I think this is one of the reasons why it can be underdiagnosed. So it can mimic things like sacroiliac joint problems, it can imitate disc problems, lumbar facet problems, piriformis problems, glute problems, IT band syndrome, groin strains, just to name a few. The pain that can come from this can be very, very severe. Now fortunately, there are very good ways in being able to identify this problem, and they're a very easy way to fix it. So let's go through how you identify this problem. I'll say there's 3 main tests that I use personally that I find very indicative. Now obviously the first thing you're always going to look at is where the pain is, and typically in this kind of condition it's going to be in the low back. It could be literally right over the SI joint, and the most common place is going to be in the buttock, particularly the upper buttock. So the first thing I'm going to do is I'm going to palpate up and over and on top of that iliac crest. So I'm going to dig my fingers in and push down on that iliac crest, starting from the outside and working my way in, following the contours of that bone. If there's any tenderness, particularly more on one side compared to the other, then I'll say there's a good chance that this is going to be Maignes syndrome. Now you also have to be careful because there are lots of other structures within this area that can also produce pain when you push on them. For example, if there's a tight muscle because of another problem, then this can mimic that kind of problem. So the second test, I will say, is very indicative, and particularly if both of these tests are going to be positive, then there's a very high chance this is going to be Maignes syndrome, and that's going to be a skin roll. So you're literally going to pick up the skin, so pinch it as much as you can. Try not to touch any other structures such as any joints or bones or even muscles, and just by rolling the skin, starting from the upper buttock or even the lower buttock, you can go as low as you like, and work your way up over the iliac crest and the SIJ, going up along the lumbar spine to the top of the lumbar. And you're going to do that on both sides, looking for tenderness, sensitivity, and any difference from side to side. This can be very sensitive. If someone has quite a severe pain due to Maignes syndrome, they would almost jump out of their seat because of the pain. Now, if there is pain through skin rolling, I don't think there are that many other things that this can be except for Maignes syndrome. Now, the third thing I'm going to do is I'm going to test sensation in the area, because the main function of these nerves are sensation. So we're going to look at sharp and soft, so we can use a pinwheel and just comparing both sides, starting from the upper lumbars and working your way all the way down to the buttocks. And you can also do this with soft, using something like a piece of cotton wool. And you can look at to see if there's any difference. There may be less sharpness on one side or more sensitivity. Now, I would say if there's at least one of these tests that are positive, then there's a good chance this is Maignes syndrome. And obviously the more that are positive, the higher chance that this is going to be Maignes syndrome. So how can we treat this problem? Well, there are lots of different ways that I've seen through different doctors treating this kind of problem. Now, the most invasive is probably the nerve block. This is found to be very effective. However, I just don't think this is going to be necessary, because there are lots of other ways through manual therapy and exercises that this can be addressed that are less invasive and getting a little bit more to the cause of the problem. I've also seen people use exercises, so McKenzie exercises and stretches and nerve releases, that sort of thing can be effective. However, I've never done any of that, because I've found the most effective way of treating it is simply just releasing the nerve using just your hand and just massaging over the area to release the fascia. Now, I use a specific gel that's been designed for releasing nerves that we call the Prologel, and that looks like something like this. This gel comes from America, and it's got various different ingredients in it, and it works through three main chemicals that I've seen on their website. The first one is it's got sugar in it, which helps to promote the function of the nerve, so it helps to restore function. The second thing is it helps to reduce the acidity around the nerve, which can precipitate the pain. And the third ingredient is going to be a natural anti-inflammatory chemical that helps to then reduce the inflammation around that nerve and then adds to reducing the pain. And so this gel I found extremely effective. Now, I have to admit, I've not actually tried using any other gel, any oils or massage cream. It's possible, but by just using massage cream, you may be able to still release that nerve, and you should be able to get some good results still. However, I think because of the ingredients in here, it helps to reduce the inflammation and helps restore the function of the nerve, and you probably get a lot quicker results using it. I only have to use this maximum 2 or 3 times on somebody, and the results will come about in the first 24 to 48 hours normally. Only one case I've had where they got worse afterwards, and then they got better, and then they were almost out of pain completely, but that is very rare. Most of the time, I would say almost everyone that I've treated in this that I can think of have had a full recovery if this is the only thing that's been causing their pain. Sometimes you can get this in combination of different conditions. So please do look into this. I'm going to put an article, a very good article below that talks about Maignes syndrome. Now, this talks about it from the perspective of nerve blocks. So I do think that this is a much better treatment because it's less invasive and much easier and quicker. But give that a read, and it goes through cases of people that have had this problem. And I'm also going to put some video links below of other doctors that go through exercises. And particularly if you're somebody that you think you may have this yourself, then these exercises may be a way of treating this yourself. Otherwise, I would suggest going to see someone that knows about Maignes syndrome. So thank you again for tuning in. I hope this has been useful. Please do ask any questions that you want to ask me in the comments below. Hope you're having a great day and have a great rest of your day. Don't forget to subscribe using the link below, and I'll see you in my next video. Take care and bye-bye.